So Laura, thanks very much for agreeing to come on to Curiosity Cake. Really looking forward to talking to you. Can you tell people who you are and what you do?
Sure. So I'm Dr. Laura Lewandowski, and I am a physician scientist at the National Insittutes of Health in Bethesda, Maryland. I'm a pediatric rheumatologist and a global health doctor, and I'm interested in studying the genetic basis of autoimmune disease in global populations.
And I think you focus particularly on lupus.
Exactly. Yep. So my disease of interest is lupus, systemic lupus erythematosus in children around the world.
Yeah. Okay. So that'll be the topic of the podcast. But maybe just a bit of background to yourself. What have you done to get into that position? And what's your path been?
Yeah. So I am born and raised in Worcester, Massachusetts, and became a pediatrician, and really early on became interested in global health early in my medical training, and then kind of fell in love with rheumatology after that. And during my rheumatology training, really tried to merge those two interests, and bring them together in understanding rheumatology, not just in U.S. populations, but in populations around the world. And then, as I became more and more interested, wanted to really understand the science behind what I was seeing. And so went from kind of understanding what these patients look like and where they are to taking a deep dive on what's driving the biology and the mechanisms of their disease. And so now I'm at the NIH doing just that.
Well, so you've gone from that kind of very practical frontline, actually working directly with patients, to the behind the scenes understanding really what's going on at that lower level.
Yeah. And I'm a physician scientist, so I actually have the privilege of doing both. So I still see patients in the clinic and in the hospital, but then work a good deal of my time in the lab, understanding kind of mechanisms of disease.
Brilliant. I'm glad I've done this because I keep thinking your surname would be pronounced Lewandowski. But I think you're saying Lewandowski, is that right?
Well, it really depends on who you ask. So I do pronounce it myself, Lewandowski, but I think probably the true Polish people would say Lewandowski.
Yeah. Okay, cool. So what do you do in your spare time? I'm not sure with juggling those two roles of treating patients, understanding the science, that you'll have much for it, but what kind of things do you do?
Yeah, so well, I'm a mom of two young girls, so I do lots of toddler activities, running, jumping,
Yeah.
playing in leaves, things like that. But
Oh,
also,
that's such a nice way to describe having kids.
yeah, I mean, they're great, and they're just like these two little bundles of joy and agents of chaos at the same time. But it's great. It's all wonderful. And then, if I do get a minute to myself, I am an avid reader. So I do read lots of things, and then do also try to keep my hand in learning a little bit of music, but there's less time for that these days.
What do you play?
I'm trying to teach myself harmonica, but
Okay.
that's a hard thing to do. It used to be I did it kind of in odd, weird hours, but when the kids go to bed, keeping the house quiet is now the ultimate priority. So
Yeah.
less practice time.
What are you reading at the minute?
Oh, right now I am just finishing up The Tattooist of Auschwitz, which is a heavy read, but an important one.
Is that a bit linked to that Polish background again?
Mm-hmm. Always comes back to that.
Yeah. Wow. Okay. Brilliant. Laura, thanks very much for that. Everyone look out for Laura's episode coming up.
Thanks so much, Lee.